Hello and welcome back. I'm your host, Dr. Raj Balkaran, and more importantly, I have the pleasure today of welcoming to the podcast Dr. Lauren Tober to speak about a fascinating new publication called Mental Health Aware Yoga, a guide for yoga teachers. Lauren, welcome to the podcast.
Thank you so much for having me here today, Raj.
My pleasure. And you know what? For those listening, our roles have switched because Lauren has a lovely podcast called Grateful Life, and I was a guest on that podcast, and now it's her turn to be a
Mhm,
guest, and
I
seems to be a fair
just
bit of
loved your
synergy.
episode, Raj.
I see. All I did was tell stories.
Stories are powerful.
Yeah, maybe that's why I loved it. um, so this is a really fascinating work, and maybe you could tell us a little bit about what got you on this path. What was the genesis of this project for you?
Yeah, so the book is called Mental Health Aware Yoga, a guide for yoga teachers. So the book is designed to support yoga teachers to support their yoga students who are experiencing mental health challenges. And we know that so many people are coming to yoga for mental health reasons, and yoga teachers just aren't trained about mental health. People are coming for mental health reasons, but yoga teachers aren't really skilled unless they have some other kind of qualifications, which more and more of them do now. Yeah, there was some research that came out of Australia. It was probably 20 years ago now, probably more than that actually. I remember I was living in London. I took part in this when it came out. And a guy called Stephen Penman did some research for his PhD thesis, and he looked at the state of yoga in Australia, which is where I'm from. And he found there's a lot of data that came out of this research project. But what I found really interesting was that I think it was 79.4, nearly 80% of people who practice yoga reported that they practiced yoga for the mental health benefits, for mental health reasons. And so it's probably even more that now, like so many more people are practicing yoga, so many more people are more open about their mental health. And, there's a lot less stigma around it. We're seeking more support from it. So I wouldn't be surprised if those statistics have changed. But what is really clear is that yoga teachers are at the forefront of contemporary mental health care, and they really need to understand mental health to support their students. And so this book came out of a body of work that I've been working on for many years, called Mental Health Aware Yoga, where I have a training program where I teach yoga teachers about mental health. I always wanted to write a book, always. And when Singing Dragon, the publisher, reached out to me and asked me if I would consider writing a book, I'd actually already written it, and I was, yeah, super stoked to bring it into the world.
It's fascinating. I was reached out once by a publisher. Well, publishers reach out here and there for various academic works, but a public-facing publisher, Leaping Hair Press, reached out and asked, "Would you like to write a book on the stories behind the poses?" And I thought to myself, "Well, that
Mhm.
wasn't the book I thought I'd be writing this year, but maybe there's a need for it." But unlike you, I had to write the book and fit it in. So it's wonderful that you have the book written.
Yeah,
But
I
there's a
had the first
parallel
draft
here.
written.
Yeah,
Yeah.
um, probably in a very different way than stories behind the poses. Um, but not dissimilar. I feel like this book really has its finger on the pulse of what's happening in the world at large and what's happening in yoga in particular. And yoga, I mean, so much has changed in 20 years, 15, 5, 10, 15 years. And so yoga means a great many things to a great many people. But more and more, very many people, whether they're Indophiles or seekers or not, or regular householders or various professionals, have come across the more therapeutic or inner benefits of
Mm.
doing asanas to the point that I think you're absolutely right that now yoga is a go-to quote unquote prescription. But
Mhm.
what is the dosage, and when should it be prescribed, and when is it effective, and when should you send them to a specialist because the yoga prescription pad isn't quite hefty enough. And I think you cover a great many important themes in your book. Perhaps you can give us a layout of the book.
Sure, sure. So the book is divided up into the six pillars of mental health aware yoga. So we look at six different areas that I find are really, really important. So the first one is Western psychology. So I think it's important that when we're working in the West, that we have an understanding of Western psychology. So we look through the lens of the DSM, the Diagnostic and Statistic Manual, and the different diagnoses related to depression, anxiety, stress, and trauma. Stress isn't in the DSM per se, but it's something that most of us experience in our lives. So I felt that was really important to include. And then the second pillar is yoga psychology. So we look at mental health through the lens of yoga psychology, Patanjali's Yoga Sutras, particularly looking at the doshas, sorry, the gunas, rajas, sattva, and tamas. And yeah, we look at the way that those gunas relate to Western psychology and also how they, if someone has a predominance of one of those gunas in our yoga class, how we might notice that in the class. So there's Western psychology, yoga psychology, and then the third pillar is creating a safe container. And honestly, while we get to the different yogic practices for mental health, the safe container part of it is one of the most powerful things that we can do as yoga teachers to support the mental health of our students. And I think generally yoga teachers do this really well, but there is some important considerations. That so we can really create a space where students can feel seen and heard and met, so they don't feel judged, so they don't feel lacking, so they don't feel like they're less than because they don't have the most expensive leggings when they walk in the door, or they can't touch their toes, or they don't want to stand on their head, whatever it is. So this chapter is really about how we can create a safe container, and also behave ethically as yoga teachers. Ethics is an important part of this as well. Um, because let's face it, yoga teachers haven't always behaved well historically and in current times. And so it is important that we look at the ethical part of being a yoga teacher as well. And then the fourth pillar is therapeutic. Looking at therapeutic processes for yoga teachers. So it's important, I hesitated about including this therapeutic part of it because as a yoga teacher, unless you're otherwise qualified, you're not actually offering therapy. It's important as yoga teachers that we stay within our scope of practice. So unless we're otherwise trained as a psychologist or a doctor or a psychiatrist or a naturopath, we're not actually offering therapy in the yoga class. However, there's some things that we can do to support, so it is somewhat therapeutic for our students. And so that can be the language that we can use. It can be the rhythm of the yoga class and the way that we hold space. And then the fifth pillar is yogic practices. So yoga has this amazing toolbox of practices, right? That can help us to regulate our nervous system and to feel a little bit better in the world and to maybe be a bit of a nicer person sometimes. So there's practices for down regulation when we're feeling agitated. There's practices for up regulation when we're feeling flat, tamasic, or depressed. And there's this whole like amazing practices to support us to maintain a more sattvic state when we're already feeling sattvic. Um, yeah, so we look at what practices can be helpful for mental health through the lens of the gunas. And then we also look at what practices are contraindicated. So, perhaps there's some practices that aren't a good idea. So that might be if we're feeling really anxious, for example, we don't want to do rapid breathing practices because that can make us feel more anxious. Or if we're feeling really depressed and we have a really ruminative negative spiral going on in our mind, then we probably don't want to do a long silent meditation. And we might do a shorter meditation practice or a guided meditation practice or something that's really going to engage our mind so we don't go off in this negative ruminative spiral. And then the last pillar is on mental health crisis. So this is around how can we support our students when they're going through a really tough time, whether it's crying in yoga class. And if anyone listening in has been to a yoga class, chances are you've cried in the yoga class. I know I have at times. It's not unusual for someone to cry in a yoga class. So as a yoga teacher, it's like, how do we hold that? How do we help our students? How do we show up for them but not go into rescue, fix it mode? What do we do if someone has an anxiety attack or is triggered? What do we do if someone tells us that they want to kill themselves? How can we hold that? And this, it can be heavy, this chapter, but I actually think these are important skills that we all need to have as human beings, not just as yoga teachers, not just as health professionals, not just as professors supporting your students. As human beings, I think it's important that we can show up for each other and to have these difficult conversations when we're going through tough times because let's face it, we all go through tough times.
Yeah, brilliant. I think the synergy of different perspectives or disciplines or concerns, whether it's personal growth and transformation, Eastern philosophy, yoga, psychology, psychological breakthroughs. There's so much that goes into books such as this, and to my mind, so very few people are versed in sufficient areas to bring together their skills into such a work. And I think this really is a gem. And I think part of an inextricable to why this is such a solid work, where this book could easily have succumbed to pitfalls of its own, missteps of its own. But I think it's solid. I think that that's owing to your personal training and experiences of various stripes. And maybe you could foreground for the listeners, what do you bring, what training and experiences you bring to bear on this work.
Yeah, I was actually nervous about, I have this training and it's constantly evolving, but I was nervous about putting it in writing and putting it like publishing it in a book. And because when you have something online and when you're training in person, you keep evolving. And when you put it in a book, it's like that forever, right? And I'm constantly evolving. Our understanding of mental health is constantly, and the way that it integrates with yoga is constantly evolving. So I've put it in this work. It's like, it's published, it's done. But I also with the understanding that I'm going to continue to grow and this work is going to continue to grow. Now, you said something interesting at the start that I can't remember the words that you used, but like something like this is important for our times or something. And I had a my book launched with Yoga Australia, and someone emailed me afterwards and said congratulations on like catching the zeitgeist. And I thought, I'm actually haven't, because I've been doing this for 20 years. Like it's not that this is something that I've been doing just now because it's popular. I've been working on this for over 20 years now. So I'm a clinical psychologist and I'm a senior yoga teacher, and I've been doing both for over 20 years now. And, I became a psychologist in Australia. We have this kind of internship program. And when I finished it, I was like, I don't really know if I want to do the psychology thing. Like, I like it, but I was in my early 20s. I didn't really feel like I knew enough to help people. So I went to London for 9 months, and that's where I did my initial yoga teacher training. I did like an internship, a 6 month or a 9 month internship. And then I went to India for 9 months and I studied in India. And then I came back to Australia and I did my doctorate in clinical psychology. And that's when I started researching yoga and bringing that, working out how to integrate it. And at the time, I didn't know anyone who was doing that stuff. I found a book, Yoga for Depression by Amy Weintraub, which is like a classic now. But she was the only one that I knew. I'm sure there was lots of other people doing it. In different parts of the world that I wasn't connected with. But it was, these threads that I started to pull together in my research and then in my clinical work, and, bringing them together over time. I taught on like lots of different yoga teacher training courses. They invited me to come and speak. And then eventually I decided to bring my own, to teach my own, maybe 6 years ago now.
Yeah, I mean, I can relate to what you're saying so far as, like, for example, it just happens that it's been 20 years as well, over which I've been
Mm,
undergoing spiritual training, emotional training, and more than that for intellectual training, scholarly work, one-on-one coaching. It all comes together in a sense that, it's part of your process and your gifts in this life. Having said that, it just so happens that the crops that we have been producing, or the antibodies that we're producing, there happens to be a pandemic now when those paradigms or therapies are so needed. So I think when you're that individual talked about the zeitgeist earlier in the call, in the podcast, I talked about having your finger on the pulse. Yeah,
there we
I
go.
don't, yeah, I don't get the sense at all that this is yeah, this is a fad or something that you could clearly, it's clearly from reading this and from just having a sense of you from one conversation, it is something that has been percolating and digesting for some time, and it's a work in progress, and it
Mm,
bespeaks fine perspective and insight and awareness of how humans work, even how yoga
mm,
works. so it really bespeaks one who has a great deal of practice and experience under the belt, because what you're doing is you're pointing to the practical applicability of yogic paradigms, with respect to the malaise, and the maladies of modernity. And in the latter regard, it's timely. In the former regard, it might be timeless. But you seem to be well poised to bring them together, in a sense
Mm,
where there are a great many yoga teachers who are, um, much more than yoga teachers to their students.
yeah,
But I don't know that a great many of us would have those skills and the credentials and the ability to articulate it all. So by virtue of that, I think it is a very useful, as you say, it's a guidebook. It's a guide for yoga teachers, because it's a bit
yeah.
of a mess. People don't really know what to expect anymore. There's a, it's not a maybe it's a beautiful mess, but there are so many different paradigms being called yoga, and there's so many different kinds of problems, that people come
Mm,
in with, to hoping
yeah.
that yoga will help them. And this, by the same token, this work both attunes teachers to what they can be conscious of while they're helping people, but also to what's out of beyond out not in their lane. It helps them stay in their lane as well, in my sense.
Yeah. Yeah.
How do you see it with respect, um, like, who would you say this book is primarily for with respect to what's on offer?
This book is for yoga teachers. So it's for people who are already working as yoga teachers. It's for people who are training to be yoga teachers at the moment. I would like every yoga teacher to read this book or to have this information while they're training, that this becomes just a part of what they're integrating, so they don't have to unlearn things afterwards, which is what many of us have to do.
Would you say it is to give yoga teachers, techniques on meeting the needs of their students, on being better yoga teachers? Would you say that it works best when you have some additional uh, psychotherapeutic training? How could you comment on that?
It's for both. Yeah, it's for both. Actually, when I created this training, I had yoga teachers who didn't have other qualifications in mind. That was where I was coming from when I wrote the training. And then what I found is that there were many health professionals who were really interested, who was like, "How are you doing this? Like, how are you even allowed to do this?" Because it has been a really tricky area for psychologists who are yoga teachers to integrate their work. It's getting easier now, but it's been really not an easy, honestly, thing to navigate, with our registering bodies and being told it's unethical and, all this, I think, weird stuff. But we're catching up with it now. But health professionals, mental health professionals were like, wow, how are you doing this? How are you bringing this together? I've done my yoga teacher training. I'm a qualified doctor, psychiatrist, counselor, psychologist, social worker, occupational therapist, physiotherapist. How do I bring this into my work? And so more and more, we're having health professionals come and do the training, come and read the book, and it's really helping them to bridge the gap between what they learn in their yoga teacher training courses and what they know in their therapy work. So, I have another program for health professionals. It's called Yoga Skills for Health Professionals who aren't yoga teachers, to support them to start to bring some yogic practices and philosophy into their work. But this book in particular is written for people who are already yoga teachers or who are training to be yoga teachers, who either don't have any other qualifications, they work just as yoga teachers, or they have additional qualifications, and then it supports them to bridge that gap. I would love all yoga teachers to have this knowledge. I think it's so important. I think it's definitely important if you're working in a specialized mental health setting, which many yoga teachers are, whether that's like a rehab retreat, whether it's a hospital, community center, working with refugees. There's some fantastic yoga classes going on in those spaces, and I think it's particularly important that these yoga teachers have mental health knowledge. I, but yoga teachers who are teaching in a studio, in offices, in their home space, in the gym, people are still coming to these classes for support with their mental health. So I really think that all yoga teachers need to have this information. And I'm not just saying that because I wrote a book.
No, I hear you. I hear you, and I feel you. It's not dissimilar with. asanas have stories attached to them. What do you mean? It's not
Mm,
dissimilar to. I feel you. And irrespective of the overall gist of the book, which I think is timely and important, well, because for many reasons, actually. I mean, one of the reasons is actually um, uh, it's sort of reclaiming in through the Western paradigm the extent to which yoga, even in its genesis, is a therapeutic paradigm that's engineered at alleviating suffering. That's one of the it's one of the core pillars of Indic philosophy that stems from Indic asceticism, but it comes from the world is full of stressors, and how do we address the problem of human suffering? It's one of the six paths of doing so. Now, of course, the Indic world is not dissimilar from the modern world in that spirituality and spiritual paradigms are being taken up by householders. This is why Krishna is saying to Arjuna, look, be a soldier. Being a quote unquote, yoga is, being a yogi is doing what you need to do in the world, but in this mental state, in this emotional state. And so I think,
mm,
that's one important piece. Another important piece is just being cognizant of the extent to which I can't tell you how many of my students are yoga teachers and the extent to which they come to me to provide intellectual and spiritual and sometimes emotional tools to meet their students where they're at, because at least for my students, they're coming to them for much more than postures. And so
mm,
this is why I feel this is a really important work. And uh, for nothing else, and there's so much here. Well, I think it's pillar three, safe container. This should be an
mm.
indispensable component to every yoga teacher training. I mean,
Agreed.
elements it are, I imagine, or at least hope for more emotionally and socially savvy teachers and trainers. But I had this really interesting conversation with a core student of mine about touch, about paradigms
Mm,
where there's adjustments that are expected versus paradigms where they're not. And well, you give
mm.
permission, but if you go in to be expect to be adjusted physically, are you really giving permission? And there's so much in here that's crucial.
Yeah.
And
Yeah,
but
touch
it
is
takes
big.
someone cognizant, it takes someone with emotional and sort of social intelligence, probably more so conscious of psychological processes such as yourself because of your expertise to really
Mm.
bring this out. But to my mind, this was indispensable reading for a variety of undertakings, but particularly the yoga field.
Yeah, I think the touch thing is really, really timely. And I kind of thought, with the Me Too movement a few years ago and then COVID when no one was touching anyone, I feel I thought that we would have got our heads around this and be more consent based with touch, but still it's still can be really problematic in yoga spaces. And I taught as an Ashtanga Vinyasa yoga teacher for many years, and there's a lot of touch in that. So I've kind of come from this world of being trained. I did my Ashtanga training in Mysore in India, and we were taught to put our hands on people. So I've kind of come through that. As a psychologist, I'm not allowed to touch people without signed consent. They have to sign a form to say I can touch them. So the psychology world is like, don't touch. And then, there's been a lot of like people are really interested, and there's been a lot of attention on trauma and trauma sensitive yoga. And in that field, there's kind of like you should never touch anybody. So there's like this one kind of part of yoga that's like, yeah, put your hands on people. That's it's healing, it's connecting, it's helpful, it supports them in their asana practice. And then the other side is never touch anybody because you could traumatize them. And it's not at all appropriate. I kind of sit in the middle. Personally, I choose not to touch people, and part of that is because I'm a psychologist and there's just a bit of a minefield there. But also, that's just the way that I teach. But I know that some students really benefit from hands-on assists and touch, especially because we're often so disconnected in this world that we're in, and some people don't get touch in their lives. And so having a yoga teacher offering that can be really helpful. But I do think that there's a time and a place, especially when you're working in mental health settings and people who have experienced trauma, is to not offer any touch at all. Don't even go there. And so what I've tried to do in this book is to have a bit more of a nuanced conversation about touch. It's not you should always touch, not you should never touch, but let's think about why we're touching. is it appropriate for the student in front of us? And if it is, let's be really mindful about how we're going to touch, because touch, like conversation, for me, touch is not about the actual touch itself. It's about the conversations that we can have about it. So when we ask somebody if they would like, a touch or a hands-on assist in the yoga class, we're inviting them to check in with their own needs, which is something that many of us actually don't do. We just kind of go along with whatever's happening, the next deadline or what our kids need, or, what it is. We're just kind of like going, going, going. And we don't take the time to say, well, what do I actually need? And so asking that question can support someone to tune in. And then we create the space for them to communicate it as well, which is the next thing. Like sometimes we know what we need, but we don't know how to share it. And so, especially if we've had a history of trauma, what happens when we've experienced trauma is that we haven't been able to get our needs met. We haven't, our own needs, desires, whatever, have been overruled. And so, tuning into our own needs and then communicating it, and then have somebody honoring those needs. Like it sounds like a small thing, but it is huge, huge. And so that's why I think we don't want to completely rule out touch, because while in some places touch is, not a great idea, in other places, these nuanced conversations, I think, can be really empowering and really healing if they're done in the right way.
Yeah, that's deeply resonant for a number of reasons. A couple that come to mind is I do one-on-one work with people. They're well aware that I don't have psychological credentials. I leverage. I think I do have some coaching credentials somewhere, but I leverage my training as a wisdom teacher, and we do one-on-one work.
Mhm.
And if I feel that more traditional paradigms for them, I might make a referral type thing. But one of a couple of clients that I'm currently working with, it's they'll be asked a question and then they'll be invited to pause, and before they just answer instinctively or people please or whatever, it's okay to say no, it's okay to say yes. Like, what is it? Check in with yourself. And that's been radical for them to actually stop the vasana, if you will, and check in terms of, oh, what would I want if no one else was here, rather than instinctively
Ooh, I like
placating.
that question.
Yeah.
Yeah.
What would I want
Yeah.
or do if there was no one else here to please, or there's no one else here, no other social pressures, and so creating
Mm.
that space, I think, is crucial. The other thing that was deeply resonant about what you say, clearly, I mean, I think you and I can speak for 7 hours, no problem. Maybe we will in Byron sometime
We
in
will do that in
person
Byron next year.
over chai or something else. Um, the other thing that was deeply resonant is the extent to which I make this joke that advice, spiritual advice, or I mean, a prescription, a spiritual prescription, or advice or counsel. Should I practice brahmacharya or not, Dr. Raj? What I say is advice is it's like underwear. It's far too personal to be one size fits all. A crass but hopefully apt metaphor. Like it has to be catered to someone's needs and taste and whatever fashion
Mhm.
sense. But I sort of shock them into hearing what I'm saying with this silly joke that I make. But it's rather than for some people it's no touch. For some people they might need touch, and also on top of them and their needs and their wants, I love that you're also practicing what you preach and saying, well, this is what I'm comfortable with, and this is
Mm.
where my needs are, and this is my threshold is. And one of the things that people may or may not be surprised with is whenever I have in-person retreats, I'm an online teacher primarily. All of my career is online, but I do have the retreats are to give people in-person dimension. I just had one in Los Angeles last week. A brilliant experience, lovely group of people, and um, I tease about still being in COVID mode and being contactless because I'll give a namaste. And part of my personal protocol, because of the role that we're in, because
Mhm.
of because particularly in sort of Indic spirituality or wisdom teachings or blah blah blah, I don't have physical contact with students. Period. That's just
Mhm.
not handshakes, not hugs. That's we give a namaste, and that's that. And that's part of my own personal boundaries for when I'm in space with people,
Mm.
particularly when I'm maybe staying at a space overnight with a variety of people. It's always been very lovely. And strangely and beautifully, in this recent retreat, that boundary was softened with two individuals in particular, um, partially because I needed some physical help, and they were literally physically helping me do something. Another part because one felt like a long lost family member that I'd known for years, and it was just such a warm connection. And so he asked for a hug, and I was sure it felt right for us in that moment. And so yeah, it really varies, I suppose, and it depends on where your boundaries are. And but the thing is, what you do is almost not as important as what you say. Is your acknowledgement, just what you think or how or that you're thinking, the extent to which you're even considering what you might be doing unconsciously or what other people might want or need. Um,
Mhm.
if you could wave a wand, you have
Ooh,
a magic
yes.
wand. But
Do you know that psychologists have ones?
really, tell me more.
No, it's a psychological tool. If I had a magic wand now, what would
Okay, well,
you?
apparently, yes, apparently, either I'm a wizard or a psychologist, or a bit of both. I'm not sure. Um, if you had a magic wand and
Hmm.
you could wave it and see a particular transformation in the field,
Hmm.
what might that look like?
In the field or in the world? In the field.
In the world pertaining to the book topic, along the lines perhaps of the transformation you might like the book to facilitate.
I think what one of the things that yoga does so many things, but one of the things it does really well is it helps us to quieten the mind so we can tune into our inner knowing, our inner wisdom. And so that would be my wish that we all get still enough that we can tune into our own inner wisdom. And I think if we do that, like you said, like we don't need advice from somebody else. We need to tune into that. And I think our own lives would be so much better. And I think the world would be a much better place if we all got quiet enough to listen to that within. We'd make much better decisions.
I love that. I call that the soul signal. I love
The
that.
soul signal. Uh-huh.
Yeah, mental noise. That's the metaphor, but I love that because, how many times did we know but not pay attention and pay the price? And
Yeah.
there is a deep inner knowing that we can connect to, but there's so much pain, there's so much noise in perhaps the language of the Yoga Sutras, the vrittis, the fluctuations of the mind, in the absence of which the seer or the person can abide in its own state, and maybe that is a state of being connected to that inner wisdom. Um,
Mm.
is there anything else about the book or the project or the secrets of life that you might like to share with us today?
The secrets of life. I'm just so delighted to be here chatting with you, Raj. I love that you came on my podcast. I love the whole kind of way that it happened. I found your book in the bookshop and in Byron here, and then you came on my podcast, and then now I'm on your podcast, and then you're going to come to Byron Bay, where I am in Australia next year, and it's just been this beautiful, yeah, beautiful flow of how things have unfolded. So I'm grateful for the connection.
As
I'm
am
grateful to.
I. Thank you. I think many might call that serendipity. Others might call
Mhm.
that karma. Who knows what? Kismet. I don't know, but there's definitely something there that
Mm.
makes the interactions between us both meaningful and purposeful. I think there's no question in my mind that we'll collaborate, Byron, whenever I come out. We'll talk more about that after we sign off. So thank you very much for appearing on the podcast today.
Thank you so much for having me, Raj. I appreciate it.
For those listening, we've been speaking with Dr. Lauren Tober on a brand new publication called Mental Health Aware Yoga, a guide for yoga teachers. The links in the podcast notes. Do check it out. It is a rich resource. Until next time, keep well, keep safe, keep reading, keep listening, and keep contemplating why people come to yoga. Bye for now.